Good morning. Good morning. My name is Leah Tate, and it is 9:03, and I'd like to call the California Board of Psychology one-day meeting on May 15th, 2026 to order, and ask that Ms. Whitney please call the roll.
Kasuga.
Here.
Cervantes. Fu. Harbsheets. Nystrom.
Here.
Frascate.
Here.
Rogers.
Here.
Tate.
Here.
Thank you, quorum is established.
Thank you so much. Let's see. Always happy to be back in my Cal Berkeley stomping grounds. Before we start today, a few housekeeping items. I wanted to mention that we will be taking a 15-minute break around 10:30 and stopping for lunch around 12 noon for 45 minutes. Also, this meeting is webcast, but there's no way to interact with individuals on the webcast, so public comment will only be heard in this room. And also, board members, all of us have computers that are up. We'll be referencing these computers throughout the meeting. This is where all of our board materials are. I'd like to give Mr. Polk a few moments to explain how to earn and document your CPD credit. Hello, Mr. Polk.
Good morning. Attending today's in-person board meeting provides you with CPD credit under category number 1, attendance at a California Board of Psychology meeting. Since today's meeting is designated as an in-person meeting, CPD credit will not be given for viewing the meeting through the webcast, as the webcast is for streaming purposes only, and there is no option to interact during the public comment periods. For attendees who are in person with us today, the attendance sheet provided will be the board's record of your attendance. Please sign in and sign out as needed for today's meeting. For your CPD records, please notate today's date as May 15th, 2026, and note that we are here for the board meeting. Please maintain this record, as certificates of attendance will not be provided for attending today's meeting. At the end of today's meeting, I will announce how many hours will be credited for attending the full meeting. If you must leave before the meeting has adjourned for the day, please sign out and you will be credited for the time you attended. Again, at the end of today's meeting, I will announce how many hours will be credited for attending the full meeting in person. Thank you.
Thank you so much. We're about to jump into Dr. Rogers' mindfulness exercise, which will definitely help us prepare for our agenda today. Dr. Rogers.
Good morning, Dr. Tate, and good morning, colleagues and friends. It is always my joy and my honor to provide a mindfulness exercise before we begin our meetings. Thank you always to Dr. Kasuga for putting me back on the agenda meeting after meeting. So when I was trying to figure out what practice to offer today, I didn't really know. There is a lot going on. There's a lot that we're trying to manage, and I always try to find something that will provide a little bit of wisdom, and always just try to touch into whatever my practice looks like. And so as I was getting ready for this meeting, I happened to open up an old folder of mine, and one of my favorite meditations was just sitting there. I don't know how long it had been there. But this is a meditation that my teacher offered at the beginning of the pandemic when there was so much uncertainty. And it feels timeless, so I thought I would share it with all of you today. Question, have we ever done the practice strong back, soft front? Does that sound familiar? Okay, great. Then it'll be new for everyone. Okay. If this practice feels supportive for you, I invite you to engage. If not, no worries at all. We just like to provide a few moments of grounding before we get into the business of the day. So there's nothing for you to do but rest for these next few minutes, and I will guide us and I will watch the time. So if the practice feels like something you'd like to participate in, I invite you to find a position that is comfortable, somewhere between dignity and ease. My teacher always says upright but not uptight. So finding some balance between the two. And closing the eyes if that feels supportive and available. And If it does not feel supportive or available, feel free to just gently lower the gaze. And bringing the mind, the heart, and the body into this room, into this moment, into this circle. And if the mind wanders, just gently bring it back to the breath, into the body. And as you center your attention on the body and the breath, see if you can bring your attention to your spine, to your back. And breathe into that spine for a minute, the whole long length of it. Touching into the strength in your spine. Your spine holds you up. It helps you to be upright. And you can remind yourself, if you want, silently saying to yourself, strong back, strong back. It doesn't mean that you have to physically be strong. It means a quality of strength that can move right up your spine. Strong back. Stable back. Reflecting a sense of equanimity. Strong back. The back is stable, upright, reflecting equanimity and balance. Strong back. And given all that is happening around us, we need a strong back right now. There's heavy lifting that we're having to do. And there's lots of difficulty that we're having to face. And we need a strong back. And having felt that, touch into the sense of strength that lives inside of you. And now we're going to move our attention over, gliding over to the front of the body, to your chest or your heart area. And touch the tender, open feeling in this place. Feeling the warmth of your heart. Your capacity for love and compassion. And because you have a strong back, you can let your heart open. And as you let your heart open, let the awareness in your heart begin to include whatever is present for you. Whatever is difficult or challenging, but also what's beautiful and what brings you joy. Let your heart open to the things that you're grateful for. And let your heart also be open to others. There's so much in this world that is asking us to close our hearts to one another. What would it be like if we allowed our hearts to be open and expansive and inclusive. And remember, as we sit, we're not just sitting for ourselves, we're sitting for others. My teacher always says, the heart is not a gated community. What would it be like if we let others in? Strong back, soft front. And we usually have it the other way around, all armored up around our hearts, and our backs a little bit weak and unable to stand for ourselves. And today we stand for ourselves and we stand for others. Strong back, soft front. And through this open heart, through this soft front, you can feel the world. And you can let your compassion respond. In the back, we cultivate strength and equanimity and stability, which allows us to be with what is. And in the front, we cultivate compassion that responds to difficulty. Strong back, soft front. And maybe all of these qualities are mingling together. Strength and equanimity, compassion and love. Each informs the other. Strong back, soft front. In a moment, I'm going to ring the bell to bring the practice to a close. Don't feel a sense of urgency to swing your eyes wide open. When you hear the bell, just gently bring your attention back into this room, holding on to your strong back and your soft front. Thank you, everyone, for your practice.
Thank you so much, Dr. Rogers. Is there public comment regarding the President's Welcome, agenda item number 2? Thank you, and I'd like the record to reflect that Mr. Fu has joined us. Welcome.
Good morning. Amen.
We will be taking up agenda item number 3. This is public comment for items not on the agenda. The board may not discuss or take action on any matter raised during this public comment section, except to decide whether to place the matter on the agenda of a future meeting. Before I invite speakers to come forward for public comment, I would ask individuals making comments to not discuss the specifics, including names as to pending complaints, pending licensing applications, or pending disciplinary actions that may come before the board for a decision. This refers to current or pending complaints and possible future complaints. Such discussions are considered ex parte communications, as they could provide information to the members that is outside of the record in violation of the Administrative Procedure Act. While there may be a desire to engage in further discussion with comments, the board may not discuss or take action. Although this gives the impression we are not being responsive, these procedures are critical to ensure the compliance with the Open Meetings Act and to avoid compromising the speaker's goals or the board's mission. Additionally, if there is a speaker before you who expresses thoughts that are extremely similar to yours, please feel free to verbally agree with previous speakers instead of repeating the exact same comment. Are there speakers, just by show of hands, interested in public comment? Perfect, thank you. Each speaker will have 2 minutes. And before I open it up for public comment, I would like to acknowledge that the board has received written comments, and we acknowledge and have read those. Thank you very much. If you do have a public comment, please come forward and have a seat, and make sure the microphone is kind of close.
Hi, is this working?
Yes.
It is.
You can pull it
great.
closer if you want, but,
No.
okay.
Hi, I'm Dr. Elizabeth Winkleman with the California Psychological Association. I'd like to provide brief comments on the issue of psychological associates and APA-approved internships. This issue, as you acknowledged, Dr. Tate, is outlined in an email sent from CPA to the board on May 7th and included in hand carry number 1. Before making comments, I'd like to request the board's instruction on whether my comment should be presented now or if they can be presented during item number 10, the licensing report, in which case there could be discussion at that time.
Agenda item number 10 would be more appropriate.
Okay, terrific. And I think that there are a couple of other attendees who would also want to make brief comments on the same topic, so also item number 10. Thank you
Yes,
very much.
Of course, thank you. Any other public comment at this time?
He may not be able to be here. What time is number 10 going to be?
I wish I knew. I believe it will be this morning. Yes. If I can make it happen, I will. Any other public comment for items not on the agenda? Perfect. Thank you so much. Agenda item number 4 is discussion and possible action to approve the board meeting minutes from February 13th, 2026.
So moved.
I second.
Thank you. Any other board comment? Any public comment regarding agenda item number 4, discussion and possible action to approve board meeting minutes from the February 13th, 2026 meeting? If so, please come forward. Thank you. Can you please call the roll, Ms. Whitney?
Kasuga.
Aye.
Cervantes. Fu.
Aye.
Harbsheets. Nystrom.
Abstain.
Rascate.
Aye.
Rogers.
Aye.
Tate.
Abstain. Did it work?
Thank you.
Did that work?
We only have 4.
Okay. Call the roll, please.
Kasuga.
Aye.
Cervantes. Fu.
Aye.
Harbsheets. Nystrom.
Abstain.
Rascate.
Aye.
Rogers.
Aye.
Tate.
Aye.
Thank you. Motion passes.
Thank you. Moving on to agenda item number 4, the president's report. Included in the meeting materials are the remaining 2026 meeting calendar. This includes all committee meetings and board meetings, and our next full board meeting will be in sunny San Diego, August 14th, 2026. Any board comment on that item? Any public comment on the item, the president's report? If so, please come forward and have a seat. Thank you. Moving on to the executive officer's report, Mr. Burke.
Thank you very much, Dr. Tate.
My name is John Burke. I'm the Executive Officer,
I know, so awkward.
Executive Officer of the California Board of Psychology. Item 6A, personnel updates. We currently have 3 vacancies of various analysts, 2 in enforcement, although 1 is going to be filled imminently, and then 1 in the Central Services Unit. It's the legislative analyst position. Additionally, there is 1 licensed member vacancy on the board itself, and we're waiting for an appointment from the governor there. Are there any questions about the personnel update?
I just have one question, Mr. Burke. What's the difference between analyst 1 and 2?
I think analyst 1 is the old SSA, so that's the lowest level of analyst. I'm not trying to diminish them, but that's, and then the old AGPA, the Associate Governmental Program Analyst, which is a higher form. They can do more deep analytical tasks.
Okay.
Based on that.
Okay, just curious. Thank you.
No problem. Okay. Item 6B is communications with other jurisdictions. I'm going to provide an update on Texas's exam development and my conversations with them under that item, unless anyone would really like to hear now. But there have been other conversations. So myself and the enforcement manager have been in direct contact with counterpart agencies in Illinois, Texas, Nevada, and Utah to discuss artificial intelligence mental health legislation, which has popped up in those jurisdictions. Additionally, we have been in contact with, so far, I think, Illinois and Texas, just trying to learn more about how PsyPact and enforcement work. And that's part of preparations we're doing for the Telepsychology Committee meeting, which will be happening this summer. Are there any questions on my conversations with other jurisdictions? Okay, now on to item 6C, which is an informational update on recommendations published by the Legislative Analyst's Office relating to the mental health receivership that CDCR, the California Department of Corrections and Rehabilitation, have been placed under by the federal court relating to their high vacancy rate in the mental health area. And it's specifically to address the receivership has happened to take control of the delivery of mental health services. In response to that and how to help them, CDCR, that is, address this, the Legislative Analyst Office published a report, and there were 2 recommendations in that report which are of, I believe, of some concern to the board. Initially, they propose eliminating the requirement for licensed out-of-state providers to get California licenses, and the other one is asking the court to allow telemental health providers to work from out of state without registering with an agency. At this time, I want to stress no legislation has been mandated by the court, and if such legislation were proposed, it's anticipated the board would probably, and other boards would oppose that. The court could make an order, but there would have to be legislation in which to enact it, in which case we would then be able to take formal positions and work with all parties to try and address something moving forward. So that's the update. I just wanted to make the board aware. Thank you.
Mr. Burke, with regard to the high vacancy rates at CDCR, historically, what's been the main driver of that?
Any answer I gave now would be sort of highly speculative. I don't know. I have heard that the compensation for psychologists within CDCR might not be commensurate with the private sector.
Right, that's what I was going to go with, which is, it sounds like it's a reimbursement issue rather than an out-of-state of practice issue, and so certainly if there's any legislation introduced to allow for out-of-state practice, one could argue that perhaps they should also consider increasing the reimbursement rate so that in-state psychologists would see that as a career path for them. As a follow-up question, does CDCR allow for any of our probationers to take on a role at CDCR?
I don't know.
I ask that question because we frequently get requests for early termination of probation. And the citation, the reason for that request usually isn't grounded in rehabilitation or expressing of remorse, but more of a financial capacity. And the argument has always been it's extremely challenging to find a job when you're on probation. So I would be curious if CDCR is pursuing legislation to allow for out-of-state practice and unregistered folks to do telehealth, perhaps they might consider thinking about allowing for telehealth of in-state practitioners who are on probation and who are seeking a role. And we all understand that our licensees on probation are monitored and et cetera. So this wouldn't be without the proper safeguards in place. But I think certainly would be curious to better understand what we're doing to support our in-state licensees who've gone through the process of getting licensed in the state of California before we consider the extraordinary measures to look out of state on that front. So for the next, we're in sunny San Diego, assuming there's been no legislation introduced, certainly would appreciate an update and maybe even invite CDCR for a presentation to the Board of Psychology. Time allowing, I know it's a one-day meeting and we don't have any petitioners at this point to make it a two-day meeting, but I think it's certainly always helpful to hear from another department that is looking to affect how we govern our practice here in the state.
Thank you.
Mr. Burke, just wanted to ask, and also it's a comment on the collaboration between the people that recommended the Legislative Analyst Office, for instance, and the Board of Psychology on an earlier part of the creation of these recommendations, because I think that springing it right now and being informed right now that this is their recommendation seems like causes more friction than maybe collaborating on what could be helpful for their needs.
Yes.
So my question is, as stakeholder, is there communication between the board staff and CDCR and the Legislative Analyst Office?
We have been in contact with psychologists that work within CDCR discussing this item. They've been giving us their opinions. It's been very useful information. There's been no formal at the sort of department-to-department level. So the people really in charge of any of these implementations at this point, I think, would be the receiver itself. And we haven't had a contact with that. Regarding the Legislative Analyst Office, the board itself was not contacted at all during the process of them developing the report. And so we only learned of it essentially when it was published.
Yeah. Well, thank you. That's really helpful information.
Thank you.
I'd like to open up this topic for public comment. If anyone has a public comment, again, we're not debating the merits of CDCR psychologists or out-of-state psychologists. This is just an informational only. So please come forward if you have a comment. Thank you. Sorry, I should clarify, this is for all items under 6, so you're fine. 6A through 6C. So.
Hi, my name is Dr. Susan Swartz, and I just, this discussion about psychologists working at CDCR, it does seem to be a complex topic. And one factor that might be contributing to perhaps some of the licensed, non-probationary California psychologists perhaps not working at CDCR. I've heard it's a highly litigious environment. And And so there are, some psychologists feel their license, is kind of at risk there more than in other incarcerated settings. And the cost of the insurance, malpractice insurance, and also just the emotional weight of possibly being sued. So that's just something else I wanted to contribute. It is unfortunate that CDCR has such difficulty getting qualified psychologists because the need is certainly great. Thank you.
Thank you for your comment. Any other public comment on this item? Please come forward, have a seat. Thank you. Moving on to agenda item number 7. This is the DCA update, which will be provided by the Assistant Deputy Director of Board and Bureau Relations, Lucy Saldivar. Welcome.
Good morning, board members and staff. My name is Lucy Saldivar, and I'm the Deputy Director of Board and Bureau Relations at the California Department of Consumer Affairs. Thank you so much for the opportunity to provide an update from the department. Firstly, DCA would like to thank board members for completing their annual Form 700 submissions, which were due on April 1st. As a reminder, all board members must file a Form 700 with the Fair Political Practices Commission, or FPPC, 30 days after their appointment and annually on April 1st of every year thereafter. Additionally, board members must file a Form 700 leaving office statement within 30 days of leaving their board. We really appreciate board members' commitment to this important disclosure that provides transparency and accountability to the public. We're also excited to share that this spring, DCA relaunched its Enforcement Academy training program, which had not been held since the COVID-19 pandemic. This 4-day training program offered DCA Board and Bureau enforcement staff an overview of the enforcement process, investigations, complaint intake, and formal discipline, as well as the opportunity to learn best practices and make connections with other programs. Our March session included staff participation from over 20 boards and bureaus, and we're planning additional academies in August and October of this year. Also, DCA's Diversity, Equity, Inclusion, and Accessibility Executive Steering Committee recently selected 15 employees from throughout DCA to participate as members of the inaugural DEI subcommittee. This subcommittee will meet bi-monthly to develop and implement multiple initiatives and goals to promote positive organizational impact. The first meeting of this subcommittee is scheduled for July 31st of 2026, and we will continue to highlight their milestones and accomplishments in the future. We also wanted to remind board members about the upcoming reorganization of DCA's oversight agency on July 1st of this year. The Business Consumer Services and Housing Agency will be split into 2 new separate entities, the first being the California Housing and Homelessness Agency and the Business and Consumer Services Agency. The new Business and Consumer Services Agency will be responsible for consumer affairs, licensing and enforcement, and the Department of Consumer Affairs, which will be one of the 8 departments. DCA continues to participate in multiple work groups on the logistics for this transition, and will continue to keep you updated. And lastly, for members who are serving in their grace period and are interested in continuing their service on the board, please reach out to Member Relations. We are so grateful for your dedication to public service and are happy to work with you to relay your interest to your appointing authority. And you can reach us at memberrelations@dca.ca.gov. To close, thank you for your commitment to consumer protection, and I'm available for any questions you might have.
Thank you so much. We appreciate you being here. Any board members? Questions? Oh, Mr. Fu.
I am a bit chatty this morning, apologies. Deputy Director Saldivar, just 2 questions. The first is, can we receive a status update with regard to the appointment of a director for DCA? Because I understand it's currently Acting Director Lally. So what is the process, where are we in the process, I guess, if you will, for appointment on that front? And then relatedly, do you expect to have a acting secretary in place for the reorg on July 1st? Or will there be a permanent secretary taking over on July 1st?
Yeah, wonderful questions. For your first one, in regards to director for DCA, there currently are no updates to share at this time. I know that the governor's team is working, to make that appointment. At this time, Acting Director Lawley is serving in that role. And then with regards to your second question, just this week, a secretary was appointed and announced for the new agency, and we'll provide more updates on that at a future meeting.
Thank you.
Yeah, of course. Thank you.
Thank you. Any other board comments? Are there any public comments for the Deputy Director? Please come forward and have a seat. Thank you.
Thank you so much.
We're moving on to the budget report. This is agenda item number 8. Ms. Whitney, please.
Good morning. Thank you. So the materials for item 8 can be found on page 26 of the combined packet. So the current projections are based on fiscal month 9 for the 2025-26 fiscal year. So for fiscal year 2025-2026, the board is projected to collect $10.246 million in revenue. And as of April 2026, the board collected $8.530 million in revenue. The board's expected expenditures are $8.181 million, and the board is projected to expend $8.008 million, leaving a projected balance of approximately $122,000. I'm open to any board questions you may have.
Thank you, Ms. Whitney. Any board comment, maybe from the chatty Mr. Fu?
I'm here.
Oh, perfect. I'd like to open up this item for public comment. Any members of the public who have questions regarding the budget, please come forward and have a seat. Thank you, Ms. Whitney.
Thank you.
Moving on to the enforcement report. This is agenda item number 9. Mr. Phillips.
Good morning. Agenda item 9, enforcement report. Please find the attached overview of enforcement activity conveying complaint, investigation, and discipline statistics to date for the current fiscal year. The enforcement unit has 2 vacant positions. Interviews for the Analyst 2 position were conducted on April 20th, 2026. Interviews for the Analyst 1 position are pending. Complaint program. Since July 1, 2025, the board has received 975 complaints. All complaints received are opened and assigned to an enforcement analyst. Citation program. Since July 1, 2025, the board has issued 4 enforcement citations. Citation and fines are issued for minor violations. Discipline program. Since July 1, 2025, the board has referred 29 cases to the Office of the Attorney General for formal discipline. Probation program. Enforcement staff is currently monitoring 19 active probationers. There are currently 9 told probationers. Attachment 1, overview of enforcement activity. Performance measures were not available at the time of this report, and this item is for informational purposes only.
Thank you, Mr. Phillips. Any board comment regarding the enforcement report? I'd like to open up this item for public comment. Any public members have comments regarding the enforcement report? Please come forward. Thank you, Mr. Phillips.
Thank you.
I'd like to open up agenda item number 10. This is the licensing report. Ms. Zhang.
Good morning, board members and attendees. I'll be presenting on item 10A, which is the licensing report. On attachment A, it is a snapshot of the number of board license types and different license statuses as of April 15th, 2026. I want to note that on the table presented in attachment A, it now includes the most recent license type that we are tracking as of January 1st, 2026, which is the temporary out-of-state license. On attachment B, we have the application workflow report. This attachment shows the different license type, open and approved application between October 1st, 2025 and March 31st, 2026 at the time the stats were pulled on April 15, 2026. Starting with the psychologist application workload report, we have the exam eligible for each WOP, numbers fluctuating in the 6-month period shown there. The exam eligible for complete is the transaction we use for first-time complete test taker, and there appears to be an increase at the beginning of each quarter, such as in October and January. For the complete retake transaction, it has a significantly higher number of approved applications in October and January because complete candidates are allowed to take the complete once a quarter. Therefore, if the candidate submitted a retake request application before their eligible quarter, we will approve the retake request application at the beginning of the next quarter. For the initial application for psychology licensure transaction type is the data for the request for initial licensure application. That is the last application submitted to the board once the applicant passed both the EPP and complete. We currently use this transaction as a follow-on transaction, so the data for the open application does not reflect an accurate open application, but the focus on this transaction would be the number of approved application. Moving on to the psychological associates application workload report, we have the first transaction, which is the initial application. It shows a significantly lower approved application volume towards the end of 2025, but this is actually a common trend we observe in the past reports. It could possibly be aligned with the students' schedules, such as when they start a program in the fall season. For the change of supervisor transaction, it includes the request for when a psychological associate changes, add, or remove a supervisor and or service location, or when a psychological associate is requesting to return from an active status. The data shows a slightly decreasing trend of approved change of supervisor application, and this is also a similar trend we have observed from previous years. Now onto the psychological testing technician application workload report. This is one of our newer registration types that became effective in 2024. The psychological testing technician initial application data fluctuate a bit throughout the 6-month time frame shown on the chart, since we do not receive many of these applications. But it appears that we have been receiving more of them consistently than when we first started. And then onto the next attachment, we have attachment C. It shows us the application and notification received from April 2025 to March 2026. When comparing the new application and notification received in the last 12-month period to the same 12-month period in 2024 and 2025, there is an increase of 9 psychologist application, 1 psychological associate notification, 9 psychological testing technician application, and 22 psychological testing technician notification. And coincidentally, we have the same volume of psychological associate application of 736. And then on attachment D, this attachment provides a 6-month overview of average application processing timeframe and business days. Many of the application type appear to have a lower average processing timeframe in the recent month in comparison to the timeframe in November and December for the register in December 2025. And then for the research psychoanalyst and student research psychoanalyst, we have not received many of these applications, so that's why the application processing time data for these 2 categories is limited. And then before I end the licensing report, I also want to touch base on the public comments we received from CPA, which is the California Psychological Association. Since we received the comments, we have been reviewing the questions, and staff have already started working on a FAQ with a plan to have it posted on our website by August of this year. And so, so then hopefully that will help guide some applicants to earn their hours. And I also want to say thank you to Dr. Elizabeth Winkleman from CPA that who sent us those questions. It's really helpful to get us started with this FAQ. All right, that's all I have for the licensing report.
Perfect. Thank you so much for giving us the update regarding the FAQ, and appreciate your report. Any other board member comment regarding the licensing report? No? Okay, I'm going to let Dr. Rogers go first.
I just have a comment and a quick question. Ms. Young, I just want to tell you thank you for all of the hard work you all are doing in the licensing unit. I know that for a long time there were questions about the lengthy processing times, so I know you all have worked really, really hard to get those times down. So my question for you is, how is it for the unit with these new registration types? I know that the numbers are not large for the research psychoanalyst and student research psychoanalyst category, but I imagine they may go up over time. So just wondering how this is for you as we're absorbing these new categories.
Thank you for your question, Dr. Rogers. So it seems like right now it's pretty manageable. As you mentioned, with the new license type, it's not a large volume. So right now it's manageable.
Okay.
It seems like we haven't got much complaints about it, so that's okay for our unit so far.
Okay. I wonder about morale sometimes when things get overwhelming, so glad to know
Yeah.
that it's feeling manageable for your unit.
Yeah, and at our last board meeting, Stephanie did share some of the deficiencies that contributed to the delay of application processing time. So most of the time, the application are delayed because of deficiencies. So it's really helpful to look at the FAQ we have on our websites and send sufficient documents to assist staff review, so it will not delay their processing time.
Thank you so much.
Of course.
Mr. Fu?
The question I have is for the other public comment that was submitted in a written format, which is, could you remind us again that the purpose of the psychological associate registration in the context of the broader licensing scheme that we have here?
Do you mean the psychological associate role?
Correct, yes.
Okay, so for the psychological associate, it's a pathway for the trainee to accrue hours. And so the board oversee the registration. One of the change between, or the difference between the PSB, which is the psychological associate, and the intern, which is referenced for the public comments. It's the name difference, and with the registration, we also require them to submit documents to us, such as when they change supervisor or service location, they're required to report to us within 30 days of leaving their employer. And also, we have distinct guidelines for them to comply with. And so with that, we want them to follow our regulation. And so that's pretty much the difference. We oversee them because we issue the registration.
And the purpose of that registration isn't a long-term permission to practice. The purpose of that registration is to provide time for them to accrue the appropriate hours to take the EPPP. Is that correct?
That is correct. So the psychological associate registration is limited to 6 years currently, and we do have a regulation that allowed them to request for an extension if needed. So if they do need more time than the 6 years, then they can request an extension to us, and then we will review that extension, whether if it is to be granted or denied. And then we also have other pathway for them to accrue hours as well.
And last question on this topic, which is, I believe, it's been a while since I've been on the licensing committee, but I do recall that there was a discussion in the licensing committee as with regard to the extensions for folks who are taking time for medical leave or for other purposes. Can you just share at a high level what are some of the pathways for requesting that extension that have been approved?
Yeah, of course. So for the extension request, when it gets to the board, we review it, staff review it, and we have the guideline which you mentioned, and it has some reasons for the extension request that would qualify the individual for staff review. And one of them is if they are requesting an extension because they were providing care for a family member, or if they got an injury, and then there's like two other ones. But If they fall within our staff review guideline, then staff can review the extension request right away and make a determination on their extension request. If it falls outside of staff review guideline, then it has to go to the licensure committee, which I believe you are on there before. So it goes to the licensure committee, and that's when they will review the extension request altogether at the licensure committee meeting. Then they will make a decision then.
Perfect. That's really helpful. I think sometimes when we see public comment about the 72-month or 6-year limitation, it's usually on the auspices of their desire to continue to practice, rather than because of challenges taking the EPPP. And I think it's always a helpful reminder with the licensing report to understand the purpose of the associate registration, which is to accrue the necessary supervisionary hours to take the EPPP, and it is not a mini license, if you will.
That's true.
And I think that's important to emphasize when we talk about that registration category. So thank you for the extended Q&A, Madam Chair. I appreciate it.
As always. Any other board comment on this item? I'd like to open this item up for public comment. If you do have a comment on agenda item number 10, please come forward and have a seat. You're going to have to share that microphone. Yep.
Hi, it's Dr. Elizabeth Winkleman again with the California Psychological Association. First of all, I want to thank the board staff for developing the FAQ. That is going to be extremely helpful, and we really appreciate it. This is for proper procedures and documentation requirements for psychological associates who are concurrently will be in APA-approved internships. I wanted to give just some really brief background for the people that did not read the hand-carry materials, which may not be everybody in the room, that the guidance is needed to facilitate the implementation of AB 2703, which was co-sponsored by CPA and supported by the Board of Psychology and went into effect in 2025. AB 2703 allows psychological associates to provide services in federally qualified health centers, or FQHCs, and rural health clinics, or RHCs, and allows Medi-Cal to be billed for those services. It's an important new law because it increases training opportunities in community health settings, and it expands access to mental health care in underserved areas. So some FQHCs offer APA-accredited internships, meaning that the interns at those sites have in the past earned their SPE, Supervised Professional Experience, as part of a formal internship, which has led to confusion and complications this year as to the proper procedures and documentation if they are concurrently need to register as psych associates for reimbursement purposes. So the training programs have requested that the board would consider in developing these FAQs the possibility of continuing to earn SPE hours as interns, because that would make the procedures go a lot more smoothly and efficiently. And I believe that it may be allowed under the regulations as long as they're not in both earning the SPE in both categories at the same time. 30 seconds. Okay. I'll be quick. And just to explain, it's a high-stakes issue for both the trainees who need to be sure their SPA hours will count towards licensure, and for the treatment centers that really need the Medi-Cal reimbursement to support training programs and access to services. Again, thank you so much for developing the FAQs, and CPA would be glad to assist in any way that may be helpful. Thank you.
Thank you, Dr. Winkleman.
Good morning. I want to first thank the board and Dr. Zhang for, did I say your name appropriately? Zhang, sorry. Ms. Zhang, for your work supporting the field in so many seen and unseen ways. I am personally deeply grateful for the work that you all do, and because I wear many hats throughout the states, I want to extend my gratitude from some of those other positions as well. But today, I especially want to thank you for your support of AB 2703, which has a big impact on the communities that I serve and care deeply about, communities that do not have enough and good access to mental health care. My name is Michael Chingarius. I'm the Chief Clinical Training Officer for Integrated Health Psychology Training Program at The Right. I work closely at FQHCs and an APA-accredited training program supporting and serving underserved communities across California. When AB 2703 allowed for psychologists to bill, I saw psychologist trainees to bill. I saw it as a critical opportunity to improve access to care in a time of profound workforce shortages and mental health needs across California. It created a possibility for psychology training programs to have greater practical impacts while having clinicians grow professionally and remain in communities that need them most. I have watched as excellent postdocs were passed over for non-psychologists because they needed the structure within 2703. And as clinician and a leader working in FQHC partnerships, I see every day the importance of stable supervised workforce pathways for underserved communities. Our students help medical residents develop greater psychological sensitivity in patient care, help families heal from trauma, and help build systems of care that strengthen community health from the inside out. Right now, however, the uncertainty around the implementation and reimbursement structure and supervision pathways and the trainee designating are creating some real confusion for structured programs trying to operationalize this law. And nearly all of the programs that I work with and that I know around the state also function as AP internships, not just associates. I just want to thank you for your support, for your consideration, and I'm happy to be of service in any way or get you in contact with other leaders for this matters board. Thank you for your time.
Thank you.
Good morning.
Good morning.
My name is Gilbert Newman. I'm the Vice President for Academic Affairs at the Wright Institute. And also for transparency reasons, I'm also a board member of the American Insurance Trust, the premier liability provider for psychologists in the United States. I'm very proud of having been one of the architects of the Integrated Health Psychology Training Program that Dr. Changaris just mentioned. We've been able to serve thousands, tens of thousands of patients in the East Bay and beyond since its inception. I want to thank you for your continued work safeguarding the integrity and the future of psychology in California. I especially want to acknowledge your support of AB 2703 and the thoughtful attention now being given to the implementation questions emerging across the field. AB 2703 represents a significant structural opportunity. California faces profound behavioral health workforce shortages at a time when demand for mental health services continues to accelerate. This law creates an important pathway for psychology trainees and early career psychologists to become more sustainably embedded within community health centers, particularly in historically underserved regions where recruitment and retention remain persistent structural challenges. At institutions like ours, we watch trainees develop deep roots in the communities where they train, contributing not only direct care, clinical care, but culturally responsive practice within complex public health environments. Many want to stay. AB 2703 gives institutions like ours a framework to support that trajectory from intern to postdoctoral fellow to durable community mental health, behavioral health leaders. At present, uncertainty around reimbursement structures, supervision pathways, and trainee designation is creating a real operational challenges for training institutions and community health systems working to implement this law responsibly and at scale. Do we have another minute or 30 seconds?
No.
No?
But you can say, you can make a closing sentence if you'd like.
AB 2703 has the potential to meaningfully strengthen California's long-term behavioral health infrastructure while maintaining the rigor and integrity central to APA-accredited psychology training. Thank you very much.
Thank you. Any other public comment at this time? Thank you. Ms. Zhang? Yeah, we're moving on to 10A. Thank you.
So for 10A, which is the examination report, I'm going to present on those EPPP and complete stats. For the EPPP monthly examination statistics for January through March 2026, the pass rates average at 37.53% so far in 2026, with an overall first-time pass rate of 16.54%. First-time pass rate tends to be higher than overall. First-time pass rate tends to be higher than overall pass rates. Then on the EPP statistic chart, the pass rate for 2026 are actually trending lower than most previous years. Moving on to the complete. For the complete, the pass rates average at 77.35% in 2026 so far, with the overall first-time pass rates of 79.31%. On the complete statistic chart, the complete pass rate in 2026 are relatively consistent with previous years. And that will conclude the examination report.
Thank you so much. Any board comment on the examination report? Any public comment regarding the examination report? This is agenda item 10A. If you do have a comment, please come forward and have a seat. Thank you very much. Thank you, Michelle. Moving on to the continuing professional development and renewals report, Mr. Polk.
Thank you and good morning. Included in the meeting materials on page 47 of the combined packet are the reports for continuing professional development and renewals. Attachment A on page 49 shows the percentage of renewals that were submitted online versus mailed in. Between January 2026 through March of 2026, an average of 93% of psychologists and psychological associates renewed online using the BREEZE system, with an average of 7% of licensees and registrants renewed by completing and mailing in the paper application. Attachment B on page 50 shows the percentage of renewed psychologist licenses processed between January 2026 through March of 2026. An average of 80% of psychologists renewed as active, with approximately 7% of psychologists renewing as inactive. Retirements account for approximately 2% of the renewals. These percentages continue to be similar to prior years. However, the retirements did account for approximately on average of 4 to 5% of the renewals of 2024, where in 2025 they accounted for 2%, and currently that trend seems to be continuing. Attachment C on page 51 shows the renewal percentages for the registration types. Psychological associates account for 9% of the monthly renewal applications. Psychological testing technicians, research psychoanalysts, and student research psychoanalysts account for approximately 1% of the renewals. CPD audits for the months of April of 2025 through March of 2026 are reflected in attachment D on page 52. Currently, approximately 2% of licensees are selected at random based on each month's approved renewals, and licensed board members are audited every renewal cycle of their license. The pass rate reflected in the meeting materials is 73%, with 7% of the audits pending review, 18% of audits awaiting submission of the CPD documentation, and 1% of the audits have failed. I'd like to provide some updated percentages on the CPD audits. The November 2025 audits had a 100% pass rate. December of 2025 pass rate is currently 90%. 10% of December audits are deficient. The licensees have been notified, and I'm currently working with the licensees regarding their deficiencies. For the January 2026 audits, 100% of the audits and documentation has been received, and the pass rate is currently 47%. No additional failed audits at this time. Attachment E on page 53 is the chart that reflects the common activities that are used to complete the CPD requirements. Information provided was determined by using the completed audits from April 2025 through January of 2026 that passed. Still, the two most commonly used activities continue to be sponsored continuing education and peer consultation, followed by self-directed learning and supervision. The remaining CPD activity percentages remain steady, and majority of the CPD activities are being utilized to complete the CPD hours. However, there has again been a slight increase in the use of the activity of attending a board or committee meeting. Seeing the increase of this activity, I did review past attendance records and would like to provide some statistics regarding attendance at our board and committee meetings. In 2024, an average of 17 individuals attended in-person board meetings. Committee meetings held virtually had approximately 250 individuals on average in attendance. In 2025, in-person board meetings had 19 individuals in attendance on average, and virtual committee meetings held had 350 individuals in attendance. So far in 2026, 23 individuals were in attendance at the board meeting held in February, and currently between the 2 committee meetings held so far this year, an average of 440 individuals have attended. Staff will continue to compile current statistics and will continue to update the chart as more audits are conducted and reviewed, in part with staff updating the board on trends of CPD and CPD activities. Lastly, the board held an informational webinar on the CPD on March 27th of 2026. The webinar included a detailed overview of the general requirements, CPD categories and activities, CPD reporting, and overview of the audit process. I'd like to add that the recording of the March webinar is now available on the board's website, along with the presentation slides, as well as the example CPD reporting form that was presented in the webinar. The webinar had approximately 600 viewers in attendance. I would like to thank Dr. Harpsheets for her help and assistance on the webinar, as well as board staff that was in attendance. That includes my report. I'm happy to answer any questions.
Thank you, Mr. Polk. We got to get more people to come to these meetings. They're so fun and informative. Any board comment regarding the CPD report? Any public comment regarding the CPD report? Please come forward and have a seat. Yes, Dr. Rogers.
Hi, Mr. Polk. Just a quick question for you about the CPD model. I know that there was a lot of resistance to that in the very beginning. Just curious about the most recent webinar and how that was received, how psychologists are responding to the new model. I think we have a sense that most people are embracing it, but if you could speak to that a little bit more, that would be great.
Yes, so after the webinar, the reviews that we got after the completion were very positive. People were very thankful that we had the webinar that went over the full categories and activities, especially when it came to showing an example of a completed CPD reporting form and what information would be on there. Okay. People were very pleased to see that. As far as the model goes, yes, so we are receiving a lot more positive feedback on the CPD, because a lot of people are realizing, our licensees are seeing that a lot of the activities or things that they were doing in the past now can count towards hours and not just doing set 36 hours of continue. So a lot of peer consultation. So that's probably the most common activity next to sponsoring education. That people are used to complete the CPD requirements. So yes, so it is being positive. Of course, there's still clarification that needs to be needed on some of the activities. But besides that, no, it's been over majority positive now.
Okay, that's wonderful to hear. Thanks so much.
Thank you. Public comment for this item? Just asking again quickly. Thank you, and thank you, Mr. Polk, for your hard work. Moving on to agenda item number 12, the Enforcement Committee report, and the chairperson of that committee is Mr. Fu.
Thank you, Dr. Tate. I'm so happy to talk through the enforcement committee's report and the meeting that we held, and we'll go through a few of those items, and we'll be supported by Mr. Phillips, who's the enforcement manager. So at our last board meeting, we had talked about Senate Bill 903, related to artificial intelligence, brought before Dr. Kasuga's committee. And at our Sacramento meeting, we wanted to ensure that the provisions in SB 903 were consistent with our desires for informed consent, as well as patient awareness when it comes to the use of AI. So the report summarizes a lot of the bill aspects, so I will save us time here and won't do that, recognizing our desire to move things along expeditiously. However, I will point out that the bill itself is consistent with where we are in terms of consumer protection. We're supportive of the provisions in place to ensure that artificial intelligence is not used to make independent therapeutic decisions or replace the professional and clinical judgment of our licensed psychologists. And the other piece is to make sure that anything that is used with regard to artificial intelligence in this proposed legislation is consistent with any privacy laws associated with the maintenance of health records. So the committee discussed the bill more deeply and have no further comments on that front. The second item the committee discussed was with regard to a public comment that we received at our February board meeting. And the public comment that was received at our February board meeting is in relation to the public letter of approval, PLRs, that is kept on a person's license on Breeze, which is the licensing portal that we all use in the state. And so the request was for the board, and the board delegated to the enforcement committee to look at what is the current practice of PLR retention. Should it remain on a license on Breeze without any limitations, time limitations? The public comment noted that the California Medical Board has a 10-year limitation when it comes to having their PLR equivalent taken off of Breeze. We heard from our enforcement team that currently the Board of Behavioral Sciences, so a part of the Mental Health Healing Arts Boards, has a similar practice to the Board of Psychology and does not have a statute of limitations as related to PLRs appearing on the Breeze license. And for consistency purposes, the Enforcement Committee is recommending no changes to how we show PLRs on Breeze. The other thing we just want to highlight is that the number of licensees with a PLR is fairly small relative to our practice. It's 0.21% of all formal disciplines. So we recognize that this is certainly an issue that does weigh heavily, I'm sure, on our licensees who are part of that 0.21%, and we recognize the effects of that PLR. And we also think it's important that for consumers' protection purposes, consumers have the opportunity to weigh the choices before them, to understand if a PLR is there, how long the PLR has been on there, such that the consumer can make that choice with the information they do have. And so for those purposes, we're not recommending any changes. The last part, I'm going to turn it over to Mr. Phillips because he can do a far better job than I can. One of the things that we asked at our last committee meeting was with regard to enforcement practices, what are some of the notable trends in enforcement? It's been a while since, as a full board, we've had these conversations, and it was important to understand also what's the impact of our workload. I think you heard earlier from Mr. Burke, perhaps, or Mr. Phillips, that we have 2 vacancies on the enforcement committee, on the enforcement team. And so I think that should be taken into context as well with regard to the trends that were identified. So with that, I'm going to turn it over to Mr. Phillips.
Thank you, Saron. So at the request of committee member Saron, the enforcement staff, was asked to identify some of the trends and needs that the enforcement analysts and the enforcement unit are experiencing in their day-to-day work. All of the enforcement staff responded with various things that they were encountering day to day. We looked at closed cases by violation types, statute of limitations cases, and anonymous complaints, social media complaints, licensing referrals, and child custody complaints. One thing that I would like to highlight is that through the research that we did between 2016 and 2026, the board received more than 10,804 complaints, which get assigned to staff for investigation. With current staffing levels of only 2 to 5 enforcement analysts, the volume of incoming cases has significantly constrained the enforcement analyst's ability to manage their caseloads effectively. So at any given time, an enforcement analyst can have between 120 to 160 active cases, which has occasionally risen to 200. Attachment 1, the metrics at a glance. You will see some of the different case amounts that we've received. So 1,934 different case violation counts, 131 cases that have been closed past the statute of limitations, 501 anonymous complaints, 402 social media complaints. Moving on to attachment number 2, the discipline outcomes and some of the top violations, you'll see that over the past 10 years that we reviewed all of the cases, specifically cases that had disciplinary action, you'll see the violation counts for those. So those violation counts represent the number of times each violation type appeared across all settlement cases reviewed. Because a settlement can include multiple violation types, the percentages shown reflect the share of cases in which that violation appeared. And finally, some of the trend analysis that we reviewed, there's always been a conversation around child custody complaints and the amount that we receive every year. So we looked at that. We looked at the statute of limitations as an indicator of cases that get closed, evidence and cooperation barriers, and the social media complaints that we receive. Thank you, Sarah.
Thank you. And just a couple things we want to pull out from the last page of the attachment to the hand carry 2. So 51% of all cases are closed due to the statute of limitations. So that's more than half in the last 10 years. And so that wanted to highlight that as an area. And the second is with regard to the social media piece is that the complaints that are filed in our system are related to not necessarily a person's practice of psychology, but their personal or exercise of their free speech rights. And I think there's an attempt to use our complaint system to adjudicate individual behavior, which is not aligned with, of course, necessarily the practice of psychology. And so I think that is that places a burden, though, on our enforcement staff, because as I think Mr. Phillips said, it's a growing area where complaints are submitted, but it's low yield in terms of actual discipline, because it's not actually tied to a discipline issue. And the last thing I'll just note is that we note the volume, and one of the things the enforcement committee said was we would certainly welcome continued conversation with the executive staff about how to right size our enforcement staffs with regard to personnel and FTEs, and to take it also within the context, a holistic approach with the larger board as well, because we recognize. I say that because over the last few years, we've surged the number of licensing analysts to account for the longer delays in processing licenses. And since then, through the incredible work of our licensing team, we've brought those time periods down. And so just thinking through what are some of the drivers that related to enforcement so that we can continue to ensure that we fulfill our mission of consumer protection. And I just really want to thank the enforcement staff who do extraordinary work to ensure that our consumers in California are protected.
Yeah, thank you, Sarah. And very briefly, I would like to add that for the statute of limitations cases, the way that statute is listed, 2960.05, we can be time limited when a case is received. So if we receive a case that is a couple days away from the statute of limitations, that significantly impedes our ability to investigate that case thoroughly. So if a case is not timely received or submitted by the complainant, it does bar us pretty significantly. And thank you, Sayron, for your comments, although it was the entire enforcement unit, so I really can't take full credit, but I will if you're offering.
One other comment real quickly before, which is the other thing when it comes to our enforcement work is there's a need for cooperation with the person submitting the complaint. Mm-hmm. So anonymous complaints, we can certainly understand why a complaint is submitted anonymously. And there is a juncture where we need additional information from the enforcement unit does need additional information. As 23.4% of these anonymous complaints are dismissed because of insufficient evidence. And on the cooperation side, 40% of folks who submit a complaint are non-cooperative in terms of submitting required documentation. So I think that is something that as we think about the role of consumer protection and we think about empowering consumers to make sure they have the information they need, I think that's another key aspect is we certainly want to have a fair system of investigating and disciplining psychologists who are in breach of our code of ethics, et cetera. And there is a responsibility on the consumer submitting that complaint to provide the evidence and to work with the enforcement unit so that real issues can be addressed properly. So I wanted to highlight that piece of cooperation as with the enforcement unit for these things.
Thank you. Thank you, Mr. Phillips. Thank you, Mr. Fu. Dr. Rogers.
I have a question, Mr. Fu. So I think all of your points are really valid. Would it be helpful if there were something on the website around the importance of consumers sort of cooperating with
A newsletter article. Look at that. That is a great topic.
Like, as we were talking about the FAQs earlier to be posted on the website, would it be helpful to have something on the website around filing a complaint? Because I'm thinking about like the social media piece. I was really curious about that. And so what qualifies, not necessarily as what is a valid complaint, but just educating people as they're getting ready to file a complaint around, you know, what kinds of things will be investigated and what kinds of things are not.
Or what information is needed to move forward.
Yes.
So on our website, we do, go ahead, Mr. Okay, on our website, we do have a portal for folks to submit a complaint, and there are some basic guidelines in there. And in the past, we've done brochures, electronic brochures on particular topics. So I think the one that stands out to me is therapy does not include sexual behavior. And I think that brochure does a lot more detailing of what are the rights of a consumer and what are the things needed to address that issue. And that is a particularly egregious example of a violation of our code of ethics. And so I think if we can ask the enforcement unit to just take a look and review our existing information that we provide to consumers about how to go through the process and submit all the things you just said, and then perhaps at the board meeting that can be a part of the enforcement unit's next report. And then we can decide from there on out. I'm trying to delay the newsletter writing. So
I was just about to say, you guys are ignoring my newsletter. Suggestion.
So we didn't even hear that. I think
I can see that happening. But I'm going to assign it to you, Mr. Fu.
I think it's always helpful to look into a landscape analysis before we pursuing further production of written materials.
Thank you in advance for your article.
Yes.
Any other public, Dr. Kasuga?
Thank you so much, Mr. Fu and Mr. Phillips, with regards this presentation. I think that there's a lot of need for transparency with regards to the enforcement side of things, and any information that can be shared to the public is really helpful with regards additional cooperation, in particular the anonymous complaints and not getting enough evidence or kind of like insufficient documentation. We want to make sure that these requirements are communicated, that we needed to give the complainant, the licensee a fair shot at like being investigated fairly. That's the goal of the enforcement team. We need more information. We need them to provide us with more documentation to move forward with complaints. And it's also good to know, I think that's I was also going to suggest a newsletter with regards, I think there's really not a lot of information on just like the general ones, aside from the therapy doesn't include sexual behavior, that can be helpful for people that are lodging complaints. So just even like a short one on the newsletter, I think will be helpful on those, just focusing on those two topics, on the importance of the documents and why it's helpful if we don't get like anonymous complaints and have more evidence to support the complaints.
Thank you. Any other board comment? Thank you. Any public comment regarding this item, please come forward and have a seat. Mr. Phillips, you're going to have to share that microphone.
Honored to share the microphone with the staff. Elizabeth Winkleman, again with California Psychological Association. I really appreciate this discussion. And I wanted to mention that also on the side of the psychologists who are investigated, there's a lot of questions, and I think that more information on the website about how the process goes, the timeline, what to expect. I know your staff is very busy right now and you're going to have to prioritize it, but just that I think both from the consumer perspective and from the psychologist perspective, just some more details about how things work would be helpful. And I also, I like the idea of, especially with you not wasting your time, your limited time on complaints that are not going to go anywhere. I like the idea of that several of you have reinforced of really putting things out there, not that you wouldn't accept a complaint, but like things in a psychologist's personal life on social media. We don't want people to have their free speech chilled inappropriately, because if it's not clear what would be considered a complaint about their professional activities. And also even the statute of limitations, I think there's a perception that maybe as long as you get it in under the deadline, it's going to be investigated, but if you get it in a month before the deadline, there's virtually no chance. So I think certain clarifications like that could also reduce your workload, in addition to clarifying the process both for psychologists and for consumers. So thanks very much.
Thank you, Dr. Winkleman. Any other board public comment about this item? Thank you, Mr. Phillips. We'll take a 15-minute break, and we will. And we'll come back at 10:45 and resume with agenda item 13. Thank you. Thank you. We are back. Ms. Whitney, can you please call the roll?
Kasuga.
Here.
Cervantes. Fu.
Aye.
Harbsheets. Nystrom.
Here.
Riscate.
Here.
Rogers.
Here.
Tate.
Here.
Thank you. A quorum's established.
Thank you. We're going to dive right into agenda item number 13, the Legislative and Regulatory Affairs Committee update. This is with Dr. Kasuga, the chairperson of that committee, and I have had a request from the public if we could reference the page number that we're on, and if it's a hand carry item or in the packet.
Okay.
Okay.
I will try.
I know.
For agenda item 13A1, that would be on page 54 of the combined open session packet. And I'll turn it over to Ms. Whitney.
Thank you, Dr. Kasuga. So item 13A1, or A1 through 3, these are items, they're 2-year bills on watch status. And as Dr. Kasuga stated, they can be found on page 54 of the combined meeting materials. So items 2 and 3, these are the 2-year bills. We didn't take formal positions on them as a board, so we are continuing to monitor them for potential impacts on licensing, enforcement, and consumer protection. These 2 bills, AB 346 and AB 667, those have had no recent activity at all. AB 277 from Atlantis. This one did have some recent activity as of May 6th. It was referred to the Senate Committee on Business Professions and Economic Development and the Committee on Public Safety. This is for information only, and we will continue to monitor to see if these have any future activity. I'm happy to answer any questions on any of these three items.
Any question from the board? Seeing none, any questions from the public on 13A, 1 to 3? Seeing none, let's continue.
Okay, so item 13B1 is Senate Bill 903. And this one,
This is on page 55 of the combined packet.
thank you, that was the only one I did not have written down. Okay, so Senate Bill 903, we discussed on this one briefly in the Enforcement Committee report. So in January of 2026, this was introduced by Senator Stephen Padilla. It would establish new statutes to regulate how artificial intelligence may be used in therapy and psychotherapy services. The bill is intended to protect consumers by prohibiting unlicensed individuals or entities from offering therapy or psychotherapy services through AI. For licensed professionals, the bill would require clear patient consent when AI is used to support recorded or transcribed therapy sessions, and would ensure that AI does not make independent therapeutic decisions or replace professional clinical judgment. The bill also authorizes Department of Consumer Affairs to investigate violations and impose civil penalties. At our February 13th, 2026 board meeting, the board adopted a support position. Board staff prepared and submitted letters to support the Senate Business Professions and Economic Development Committee and to the Senate Privacy, Digital Technologies, and Consumer Protection Committees on March 13th. The bill was amended on April 7th, 2026, and board staff reviewed the amendments and felt these amendments clarified any remaining ambiguity in the bill's enforcement model for us. This item is for informational purposes only. No action is required. This is the bill Mr. Fu spoke briefly about, again, on the last item, number 12, but I'm happy to answer any questions the board or public may have on this.
Thank you. Any board comments, questions? Seeing none, any public comment or questions on 13B1? Okay.
Dr. Susan Swartz, and please tell me if I'm out of place asking about this, but in terms of at some places where you might work as a psychologist, increasingly I'm finding that I'm asked to consider having an app of some kind record the session. And it's presented to me as an assistance in my speeding up my note-taking and perhaps being more thorough in terms of documentation. It's presented to me as a business sort of imperative. I really see it as a question of violating the privacy. And I'm assured that the recording is shortly after the session deleted, but I have questions about that. At one place I almost worked, it was almost presented to me as something that I had to do. And I said, well, what about the person? What about the client? Maybe they don't want it recorded. And it was kind of unclear. So I guess that's my concern about how I see AI sort of encroaching on my work. But of course, the other issues that you all are, bringing up about AI perhaps, taking over more is also of concern. But I just wanted to share that. Thank you.
Thank you. Any other public comment? Seeing none, let's move on to agenda item 13C, 1 to 4.
Okay, so these just got slightly shorter. We had, there were some suspense hearings yesterday. So we will not be discussing item C1, AB 2140, or item 4, AB 1558. So I will move on to item 13C2, which begins on page 88 of the combined packet, excuse me. So this bill was introduced, it's Assembly Bill 2164, introduced by Assembly Member Rebecca Bauer-Cahan. This bill expands California's protections for individuals engaged in legally protected healthcare activities, including reproductive and gender-affirming care. It extends existing safeguards to individuals who provided or supported these services while in another jurisdiction, so long as the conduct was lawful in that jurisdiction and would be protected in California. The bill was amended mid-April to remove the introduced version's new limitation that would have tied extradition permissibility to whether the acts would be punishable under California law. After the amendment, the bill prohibits recognition of certain out-of-state criminal liability tied to legally protected healthcare services. The bill is relevant to our licensees who may provide or support legally protected healthcare services across jurisdictions. The Legislative and Regulatory Affairs Committee is recommending that the board establish a position of support on the measure. So with the committee's recommendation serving as a motion, do the members have any questions or comments on this bill?
Okay, seeing none, let's bring it to the public. Any comments or questions on AB 2164 and the motion to support the bill? Seeing none, let's move on. Oh, to vote. To a vote. Let's move on to a vote.
Okay, Kasuga,
Aye.
Cervantes, Fu,
Aye.
Harbsheets, Nystrom,
Recuse.
Riscate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Thank you, motion passes. The next item that we have is agenda item 13C, and this begins on page 99 of the combined packet. This is Senate Bill 1391, which was introduced February 20th, 2026 by Senator Aisha Wahab. This bill requires boards, bureaus, and commissions within the Department of Consumer Affairs that offer a retired category of licensure to disclose the information on their internet websites. While existing law authorizes boards to establish retired license categories by regulation, this bill adds a transparency requirement to ensure that information about such licensure options is publicly accessible. The board currently maintains information on its website to ensure compliance with disclosure requirements, including notice of the availability of a retired license category. Again, the Legislative and Regulatory Affairs Committee is recommending that the board establish a support position on the measure, with the committee's recommendation serving as the motion. Do the members have any questions or comments on this bill?
So moved.
I second.
I don't believe we need a motion.
You don't need a
because the-
motion.
It's already happened.
The recommendation is the motion and the second,
Okay.
so it's just member comments, if you want.
Call the roll.
Public comment.
Well, we have to have comments. Thank you. I just also wanted to reiterate what Ms. Whitney said, that we are already following the same information with regards to our retired licensees. So the support position is just like reinforcing what we've already been practicing.
Correct. We've been offering a retirement status since January 1, 2023.
With that, any public comments on the motion at hand to support SB 1391? Seeing none, let's call the vote.
Kasuga,
Aye.
Cervantes, Fu,
Aye.
Harbsheets, Nystrom,
Recuse.
Riscate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Thank you, motion passes. Okay, give me just 1 second to get, okay. So we're going to take these Item D, out of order slightly, we are going to begin with subsection 4 and talk about Senate Bill 934. And this item is in our hand carry packet number 1 and can be found on page 3. So Senate Bill 934 was introduced on January 29th, 2026 by Senator Scott Wiener. This bill expresses the legislature's intent to enact legislation that would provide individuals harmed by sexual orientation or gender identity change efforts performed by licensed mental health providers with additional time to seek civil remedies for those harms. Under existing law, engaging in sexual orientation change efforts with a patient under 18 years of age is considered unprofessional conduct and subject to disciplinary action by the provider's licensing board. A motion was made at the April 24th, 2026 Legislative and Regulatory Affairs Committee meeting to recommend a support position to the full board. However, after further discussion, the motion was voted down. The committee did receive an opposition letter from the International Foundation for Therapeutic and Counseling Choice, which was included in these materials as well. The committee ended the discussion by requesting a full analysis of Senate Bill 934, which was also included in the meeting materials in this item. The board is monitoring this bill because it relates directly to sexual orientation change efforts by licensed mental health providers, which are regulated as unprofessional conduct and fall within the board's disciplinary authority. I would like to clarify that this bill does not reopen the broader debate surrounding conversion therapy. The bill is intended to provide individuals with sufficient time to pursue civil remedies. This item is for information purposes only. The bill is, there is no action required at this time because the Legislative and Regulatory Affairs Committee did not take a position. However, I'm happy to answer any questions that the board may have.
Thank you, Ms. Whitney. I just wanted to add a little bit of context on what transpired during the Legislative and Regulatory Affairs Committee. Basically, we got a very robust discussion of both. I think we received a hand carry letter in support of the bill, as well as public comments that are in opposition, and because of that, we required a bill analysis. And this can be found on the hand carry item number 1, page 13 of 27, where that was provided by board staff. And based off of the review of this, I think that I'm hoping that the board will consider a support position on the bill. So the bill, I think, is basically focused on just like providing individuals with the ability to for civil remedies, and that's basically just allowing victims that may want to pursue civil remedies to be able to do so beyond statutory limits. So it's expanding the statutory limitations. And I think that as a consumer protection agency, that it's aligned with what we are. We want to make sure that that we support anything that allows for consumers to be able to pursue action if they so wanted. And I think that it is part of our. It's aligned with what the board is mandated to do with regards to consumer protection, and I think that like such statutory limits shouldn't be the reason why someone is not able to pursue justice. So with that, I'd like to move that we support the motion SB 934 and open it up to anyone who would second it.
Is there a second?
Second.
So it's been moved by Dr. Kasuga, and there's a second by Mr. Fu. Do you want to have any comments on the bill? Any public comments? Seeing none. Let's call for a vote.
Kasuga,
Aye.
Cervantes, Fu,
Aye.
Hardsheets, Nystrom,
Recuse.
Rascate,
Aye.
Rogers,
Aye.
Tate.
Aye.
Thank you, motion passes.
Thank you.
Okay, the next bill we're taking slightly out of order is going to be 13D subsection 5. This one is back in the original hand carry combined packet starting on page 157. And this is Senate Bill 1146, which was introduced on February 18th, 2026 by Senator Lena Gonzalez. This bill would require advertisements promoting health-related consumer products or services that use the image, audio, or video of a natural person that is generated or substantially altered using artificial intelligence or other computer technology, to include a clear and conspicuous disclosure indicating that the media was generated or altered by AI. The bill also establishes requirements for how disclosures must appear in visual and audio media, and authorizes enforcement actions to be brought by the Attorney General or a district attorney in a civil action. The board is monitoring this bill because it pertains to advertising requirements related to health-related products or services, which may intersect with advertising and public communications by healing arts licensees, including psychologists. This item is for information purposes only. There is no action required at this time, but I am happy to answer any questions that the board may have.
Any questions? Ms. Whitney, can you provide an example of how you think this will be potentially affecting licensees in terms of advertisement?
Sure. Part of it is that with the rise of AI, it's becoming increasingly difficult to distinguish between real and fake content online. And one of the examples given was the rise of like deep fake doctors on social media who are garnering millions of views endorsing products from like weight loss supplements to unproven medical treatments or devices. So if you would relate that into a psychologist and what they could be doing. And then another example is there was a New York Times report that identified numerous medical professionals who have had their image used to promote supplements or products that they've never seen or endorsed, so it would prohibit those type of things. So that's why we're watching the bill to see if it touches specifically on any type of activity that a psychologist would pertain to.
Thank you. Thanks for
You're
that
welcome.
clarification. Any public comments or questions? Seeing none, let's move on to the next one.
Public comment?
Oh,
Did you ask for public comment? Oh, you did? I'm sorry.
no problem.
Okay, so we have one more AI bill we want to talk about at the same time. This is agenda item 13D6, which can be found beginning on the combined hand carry the combined materials, not hand carry, page 161. So this is Senate Bill 1159, which was introduced on February 18th, 2026 by Senator Christopher Capildon. I'm not sure if I pronounced that correctly. The bill would clarify that for purposes of several California transparency and governance laws, including the California Public Records Act, Bagley-Keene Open Meeting Act, Ralph M. Brown Act, Administrative Procedure Act, Political Reform Act of 1974, and the California Environmental Quality Act, Terms such as person, interested person, participant, and member of the public do not include artificial intelligence systems, autonomous agents, robots, or other non-human entities. The bill also states that these laws are intended to enable participation by natural persons and legally recognized entities and seek to prevent automated AI systems from overwhelming governmental processes through mass submissions or automated engagement. The board will continue to monitor this bill because it affects statutes governing public participation, rulemaking processes, and public records requests, including the Administrative Procedure Act and Bagley-Keene Open Meeting Act, which apply to boards within the Department of Consumer Affairs. Again, this is for information purposes only. No action is required, and I am happy to answer any questions the board may have.
Any questions from board members?
Yes, just a
Yes.
quick question on this one. I'm curious, how does this distinguish from current practice where folks can do sign-on letters? So for example, usually there's a form letter that's available on the website, and then you say, my name is Seiran Fu, I represent this organization, and it's like a Google form submission. Like how does, in theory, a generative AI program would then be, well, first of all, draft that document for you, create the website to collect the submission, and then depending on the code written for it, upon a certain time period, submit those letters in bulk with all those persons to it? Like how does that change, how is that different than the current practice of essentially just asking people to sign on and collect those signatures to submit public comment?
In looking at the fact sheet, I don't see where they have that in here at this point.
Understood. I was just curious about
Right.
the submissions part. That's the part that I was curious about, just because.
I think we use WebEx for our hybrid meetings, to where it's not an automated process, and I'm not a tech person by any means, so I don't know all the different avenues of how all the bots work. But for WebEx, you would have to, in theory, when we log on, we have to enter a valid email and then put a name in there as well. It wouldn't be the form that you had talked about. As far as like PRAs, we could get those very easily through our email, our bot mail account, where they flood us with emails. That way, if it is a bot, I could see that happening using that form you had mentioned. Does that clarify?
It does. Thank
Okay.
you so much. That's helpful.
Ms. Whitney, do you know if other Department of Consumer Affairs boards have commented on this particular bill?
I do not know what the other boards have done on this bill.
Thank you. Any other board questions, comments? Seeing none, let's open it up to public comments and questions. Seeing none, let's move on.
Okay, so we're going to jump up to item number 1 now. So item 13D1, the materials can be found on page 127 of our combined packet. This is Assembly Bill 1568, which was introduced January 12th, 2026 by Assemblymember Juan Alanis, and would require individuals seeking removal from the sex offender registry to provide proof that they completed a certified sex offender treatment program. While the bill does not directly amend the board's statutory and regulatory authority, staff are monitoring the bill because the board has enforcement and disciplinary provisions related to sex offense-related conduct. This is for information purposes only, and no action is required, but I'm happy to answer any questions.
We'll take answers for all the remaining watch bills at the end.
Okay.
Thank you.
Okay, so the next one is going to be 13D2, which begins on page 134 of the combined packet. Assembly Bill 1775 was introduced on February 9th, 2026 by Assemblymember Christopher M. Ward, which would require boards within the Department of Consumer Affairs to expedite licensure applications from honorably discharged members of the armed forces to include individuals who received a discharge solely because of a specified federal executive order. The bill also modifies reporting requirements related to military licensure data. The board is continuing to monitor this bill because it amends business and profession code sections applicable to boards within the Department of Consumer Affairs, including provisions related to expedited licensure for military applicants, which may affect board licensure processes and reporting requirements. This bill is for informational purposes only, and there is no action required at this time. Item 13D3, AB 2366, we are no longer talking about either after the suspense hearing yesterday. So the last one in this section before we take board comment would be item 7, agenda item D7, begins on page 167 of the combined packet. This is Assembly Bill 1598, which was introduced on January 16th by Assembly Member Sharon Quirk Silva. Existing law requires the Board of Behavioral Sciences to regulate individuals licensed or registered under the Licensed Marriage and Family Therapist Act, the Clinical Social Worker Practice Act, and the Licensed Professional Clinical Counselor Act with violations considered crimes. These acts currently have differing exemptions for certain medical professionals and other behavioral science professionals, attorneys, and certain religious personnel. This bill amends regulation of licensees overseen by the Board of Behavioral Sciences. It expands exemptions so religious officials of any denomination who provide faith-based counseling as part of their duties for established faith-based entities are excluded. If criteria are met, it exempts attorneys and physicians who provide counseling within their professional practice from the LMFTA and the LPCCA. The board will continue to monitor this bill because it pertains to psychosocial and psychotherapy. At this time, the bill does not directly impact the board's licensees, but we will continue to monitor for any potential impacts. And again, this is for information only at this time. I am happy to take board comments or questions on those 3 items.
Thank you, Ms. Whitney. Any board questions on the 3 bills that were discussed? And Ms. Whitney, just to clarify, AB 1598 is basically mostly just language cleanup for BBS, for the behavioral sciences.
Yes, that's correct. The reason that this bill got onto our watch is there was an earlier draft of the bill had some language which would certainly have been of concern to the Board of Psychology and indeed the medical board, but that was not their intention. That's now gone, but we're still keeping an eye on it.
Yeah, I appreciate that we caught on early on because it's always easier to catch it early.
Yeah.
Thank you. Any public comment on the watch bills that were discussed? Seeing none, let's move on to 13E, bills for discussion and consideration for possible action for a board position.
Okay, so 13E1 begins on page 238 of the combined packet. This is Assembly Bill 2575, which was introduced on February 20th, 2026 by Assembly Member Liz Ortega. This bill establishes new requirements governing the use of artificial intelligence and clinical decision support tools in patient care. It requires health facilities and providers to provide written notice of information about AI tools, including their development, limitations, and potential biases, and affirms that healthcare workers may override AI-generated output based on their professional judgment. It also prohibits employers from limiting clinical judgment or retaliating against workers for overriding or relying on AI tools, and clarifies that developers and users of AI cannot avoid liability by attributing harm to a provider's failure to override the technology. It amends, it provides parameters for disclosure or written notice. It's relevant to the board because it introduces new standards related to the use of AI in clinical decision-making, professional judgment, and potential liability considerations for licensees. The board may experience impacts on its enforcement workload, including the need to investigate complaints involving AI use and determine compliance with any new statutory or regulatory requirements. This bill could warrant regulatory changes in the future. It does touch on informed consent on this bill. However, it will not change informed consent for the board. Board staff is recommending the board take a support position if amended and requests the following amendment on AB 2575, that we would clarify whether a violation of this section by a licensee of the Board of Psychology is subject to enforcement. The bill specifically states right now, licensees of the Medical Board of California or Osteopathic Medical Board of California is why we would like that clarification.
Okay, thank you, Ms. Whitney.
You're welcome.
Yes?
Just a quick question. What are the conversations like with this bill in context with SB 903? As I think they're fairly similar. I'm just curious if there's any issues around chaptering out, for example, or if there are any amendments needed for the bill so that there's not inconsistencies between what's in SB 903 and in this bill.
I'm going to invite Mr. Phillips to come up to see on the enforcement side if he has any insight on that. I know you guys have done a very thorough review on 903.
Sarah, can you repeat your question, please?
Sure, I'm just curious. I mean, the bill seems substantially similar in concept to SB 903, and I'm curious, one, if that's the correct reading, and then secondly, what's the impact if to the board relative to how the bills will interact with each other should both of them be adopted by the legislature?
So there is a little bit of overlap between them in terms of enforcement and how they would be kind of investigated and looked at. Mostly concerning intake, how we would process them at intake. After that, I would have to look more into how they would possibly interact with each other in that sense.
Yeah, no worries. That's really helpful. Really appreciate it, and that's just something for us. It's just a question I have given the request for our action to support the bill, and so I want to make sure that we're not actually supporting something that would conflict with our other bill that we're supporting on SB 903.
Right, so in this one, and it touches based on the public comment we had earlier too about the AI environment and the workforce. The intent of this one is to, healthcare workers, it says, may bear liability or face retaliation over using an automated system. So this is helping to allow the licensees to be able to override that and use their professional judgment and not be retaliated against for that. So it is protecting the training and expertise of the licensees.
Understood. That's really helpful. Really appreciate it. And I also just checked that this 2575 amends the civil code and 903 amends our business and professions code. So while similar in concept, they will be amending different parts of our codes so that I don't think how they work together will be fascinating, but I think impact us differently in different ways given the different parts of the code. So yeah, no further questions from me, and happy to move the supportive amended position.
So it's been moved by Mr. Fu and second by Dr. Tate. And just to add to the discussion, I think that with the new AI environment, there are different angles that would be covered, and I'm anticipating that's why we're seeing a lot more bills related to AI. And I think that I appreciate the importance of looking at each bill and what it covers. That way, when we make motions and we make decisions, we're able to see how they interact and how they are different from each other. And from my understanding, 903 mostly deals with if someone is like unlicensed and practicing and using AI to that effect. And then this one is more like if you're a licensee and you are using AI and deferring the clinical judgment on the AI instead of using your own clinical judgment, or being forced to do that by agency you're working for. So making sure that things are coming from the licensee and not the artificial intelligence. So it's just like interesting that we are in this climate where there's a bunch of AI, where there's like a lot of technology on all aspects of the practice that we have to consider now. Any other comments?
I'm sorry, I just wanted to clarify the motion. The motion is to support AB 2575 if amended to include that it applies to psychologists? Is that correct?
Yes.
Okay, just make sure.
Yes.
Yes.
Can I just make one further comment? I think the context of this bill is more in settings where there's a unionized workforce. So my understanding is the California Nurses Association has been a co-sponsor of this bill. The Labor Fed is in support of it. So happy to support the bill if amended to include psychologists, but and I do understand psychologists in certain public settings certainly are represented by a union. And I think the context of this bill may not necessarily apply to a psychologist in private practice. So just wanted to also say that out loud in terms of the further distinguishing this bill from 903.
Potentially it could, like if the psychologist has to, if they're using AI and they have to disclose that they're using AI and the extent of how they use AI, I think it's covered on this one. And so they have to still follow that in terms of private practice. But I agree with you that it applies mostly on certain type of settings. And if it's helpful, I want to refer people to the analysis, the bill analysis, and it's on page 247 of the combined packet. And usually at the end it has, it doesn't have a lot of support and opposing list, but it does have some analysis about the bill.
Yeah, I was referencing the updated analysis from the Assembly Committee.
Oh, okay.
So the Assembly Committee's analysis most recently did include a list of support and opposition. And this was the committee analysis at the April 21st hearing.
Yeah, do you have the page number for that?
So it's not included in our
Okay.
packets. I just pulled it up on LegInfo.
Okay, got it.
And so there's the majority of the support is coming from labor and organizations like Health Access California, Consumer Watchdog, Tech Equity in Action, and then the majority of opponents are coming on the business side. So California Chamber of Commerce, California Hospital Association, California Medical Association, and the tech side, TechNet. So just wanted to lift up those support and op from the more recent analysis from the Committee on Privacy and Consumer Protection.
Perfect, thank you so much. That's really helpful. And we try to provide as much information with regards to the bills.
Not a criticism, just an update.
No, that's really great. Thank you. So with that, let's move on to public comment, right? Public comment? Any public comment on the bill or questions? Seeing none, let's move on to the vote.
Kasuga.
Aye.
Cervantes. Boo.
Aye.
Harbsheets. Nystrom. Bruscate.
Aye.
Rogers.
Aye.
Tate.
Aye.
Thank you, motion passes. The last item for legislation is 13E2, which begins on page 251 of the combined packet. This is Assembly Bill 1979, which was introduced February 13th by Assembly Member Mia Bonta. Existing law requires a health facility, clinic, physician's office, or group of a practice that uses generative artificial intelligence to generate written or verbal patient communications pertaining to patient clinical information, to ensure that those communications include both a disclaimer that indicates the patient or to the patient that a communication was generated by AI, and clear instructions describing how a patient may contact a human healthcare provider, employee, or other appropriate person. This bill would require a health facility, clinic, physician's office, or a group of practice to ensure that no clinical decision is based solely on the output of a clinical decision support system as defined, and that a licensed healthcare professional exercises independent judgment when reviewing and approving a clinical decision that is based on the output of a clinical decision support system. The bill authorizes the appropriate professional licensing board to pursue an injunction or restraining order to enforce these provisions to the extent that a violation constitutes the practice of a healthcare profession without a license. The bill would specify that these provisions do not prohibit the use of AI for documentation and communication that does not involve the application of professional judgment, including automated messages to inform patients of updates to their health records. By placing new requirements on health facilities and clinics, the bill would expand the scope of a crime and would impose a state-mandated local program. The bill is relevant to the board because it will most likely increase complaint volume and increase the number of cases the board refers to the Division of Investigation to gather records, interview witnesses, and reconstruct AI-related workflows and decision points. It will also increase expert costs and time to evaluate whether the conduct involved professional judgment or license functions and to interpret technical documentation. The board staff is recommending that the board take a support position on this item. Are there any board comments or questions?
Or motion?
So moved.
I'll
Okay.
second.
It's been moved by Mr. Fu and second by Dr. Tate. And just like for clarification, can you or Mr. Phillips speak a little bit more about the fiscal impact on this bill for the board?
I can speak a little bit. He can speak more on specific costs and complaint processes.
Just for transparency.
So enforcement costs with cases like this, they can range pretty significantly. Expert reviews can generally be anywhere from a few hundred to a little over $2,000 a completed Division of Investigation, which is the sworn law enforcement branch of Department of Consumer Affairs. That can cost anywhere from, I think the lowest I've ever seen is about $4,000 all the way up to $20,000, followed by an additional expert review and any costs incurred by the Attorney General's office. So they can range pretty significantly.
Thank you. Any other questions from board members? All right. Any public comments or questions with regards to the motion before us? Seeing none, let's call the vote.
Kasuga?
Aye.
Cervantes? Fu?
Aye.
Harbsheets? Nystrom? Roscate?
Aye.
Rogers?
Aye.
Tate?
Aye.
Thank you, motion passes.
All right, let's move on to item number 14, legislative items for future meeting. The board may discuss other items of legislation in sufficient detail to determine whether such items should be on a future committee or board meeting agenda. So any future items, legislative items? Yes.
A comment on this item, which one of the things that I neglected to say, and I think is even more relevant given all the bills that we just heard, was a desire from enforcement unit staff to have access to training opportunities associated with artificial intelligence and the enforcement of artificial intelligence. And I suspect this crosses across our boards. And so to the extent which if there's an economies of scale where DCA might have opportunities for training related to the use of artificial intelligence and the enforcement of artificial intelligence for purpose of consumer protection, I know our enforcement unit staff would really appreciate it, and perhaps the department could graciously cover the expenses associated with it. I know the budget outlook is looking better and better, so given the fact that it looks like we're going to have a
No deficit.
Pardon?
Nothing.
Oh, given the fact that we have all these great one-time funds coming in, perhaps DCA might want to ask if we can use some of that for enforcement purposes and training purposes related to artificial intelligence. And then relatedly, to the extent which there's time at a future board meeting, I just would be curious if this is something that the board is interested in learning a little bit more about. Like, is there someone in the field of psychology and artificial intelligence who might be interested in doing a presentation to us? And not a mandatory request, doesn't have to show up in San Diego or at the end of the year, but it just seems like there's an incredible volume of legislation and policy emerging. And one of the things I've been proud of this board is that we're constantly at the forefront. One of the tools to be at the forefront is the continuous learning piece.
So
Considered
AI
CPD
trends,
for us.
maybe?
Yeah.
AI future trends,
Yeah.
or where we're headed.
Yeah.
And perhaps asking staff, just like, who are the right folks to present to us about this, and what are the questions we should be considering as a board? Maybe it's something for when we have a longer two-day session.
Yes.
But
Say, it may not happen in '26.
no,
Yes.
I fully understand that.
Yes.
But just wanted to get ahead of that.
I actually was thinking exactly that now that we are in Silicon Valley adjacent in the Bay Area, and with all the AI bills, I think that maybe next year it would be good if we have someone from the Bay Area that is either a licensee or one of these artificial intelligence companies that support psychologists to come forward and share information.
Yeah.
Especially since, if some of these are implemented, then we have a year run of AI involvement with our field, and maybe there's a lot of researchers out there that have some data that can support our efforts.
And to be clear, just recognizing the earlier comment, it's not about mandatory use of artificial intelligence in practice. It's more about if there are folks who choose to use it, what are the questions we should be considering as a board in relation to the context of consumer protection?
And also enforcement, where enforcement is lacking, because we are always behind. There's already harm that happens before we're able to, before there's a bill in place. And we wanted to see if there's a way we can be informed with regards to the fast movement of artificial intelligence for both enforcement and leg and reg. Yeah.
Sorry.
And the full board. Thank you. So any other items for future meetings? Let's open it up to the public. Seeing none, let's move on to agenda item 15, status review of regulations and development.
Thank you. This can be found on page 455 of the combined packet. So these, the regulatory packages in this item are at different stages of the rulemaking process. The memo provides an update on each of the progress of each package. The purpose of these rulemaking efforts is to implement new and updated statutory changes and clarify existing requirements. This item is for informational purposes only, and I do have several updates, and then I would be happy to answer any questions. The first update is on subsection A, the disciplinary guidelines and uniform standards related to substance abusing licensees. On March 27th, 2026, this regulatory package was approved by agency and sent to OAL for approval of publishing. The regulatory package was approved by OAL on April 3rd. The package was posted on April 10th, and the 45-day public comment period started at that time. It was brought to our attention that the board inadvertently omitted the document incorporated by reference in the original posting. The board has extended the public comment period while adding the document incorporated by reference to address the oversight and allow for the public to have appropriate time to review the amendments to the regulation as well as the document incorporated by reference. The board posted the disciplinary guidelines and uniform standards related to substance abusing licensees rulemaking documents to its website on Friday, May 1st, and the extended 45-day comment period started at that time, as well as posting the package to our website. We provided updates on our social media pages and sent out a listserv notice to our general subscription list as well as our licensee subscription list. Do you want to take comment now or after all three? After all three?
Dan, thank you.
Okay. So one of the other updates is subsection B. This is the standards of practice for telehealth services. The package was approved by OAL on March 25th, 2026, and will be effective July 1, 2026. The board is working on implementation plans as applicable, including updates to any procedures, advisories, and our website. And the last item is subsection F, the examinations, which was the TOEFL package. This was a Section 100 package approved by OAL, and it became effective on March 30th, 2026. Again, we are working on implementation plans, including updates to any procedures, advisories, and websites. I'm happy to take any questions on those three.
Okay, Mr. Fu.
No questions. I just want to say thank you to all of our stakeholders on the telehealth practices work. Dr. Winkleman, thank you for your extraordinary partnership over 3 years to get us through this point where I think we struck the right balance between consumer protection and also the practicalities of doing this work. And so just want to extend our gratitude to you, Dr. Winkleman, for your efforts and to be self-congratulatory as a member of the ad hoc committee on telehealth, to say that we got a reg package through in the speedy 3-year time period, which is pretty good for a reg package. So
Yes.
considering the fact that I think CPD took like a decade and a half, so yeah, that is all.
Yes, congratulations.
Thank you. I appreciate that.
Okay, any other board member comments? Seeing none. Any public comments on the agenda item number 15? Seeing none, that concludes my section.
Perfect. Thank you, Dr. Kasuga. Agenda item 16 is the update and discussion on the APA Model Act. Mr. Burke.
Thank you, Dr. Tate. This is an informational item for the board and public. The American Psychological Association publishes a Model Licensing Act. It has no force of law in California or anywhere else. It's just guidelines with language that could be borrowed were we to want to amend our Practice Act. And they updated it in 2025 it's a draft at this time. The previous published one was in 2010. But there are two quite interesting areas that I thought would be useful for the board to know. It does contain a master's level health service psychology licensure. They're called, they're potentially to be called licensed practitioner of psychology, which would be a master's level. And there's also some new language surrounding applied psychology title provisions. The materials are in, sorry, I didn't do that.
The page number.
Hand carry number 3, page 28. And it includes a copy of both the 2010 Practice Act, Model Practice Act, and the 2025 one. At the the Legislative and Regulatory Affairs Committee, there were some questions surrounding if this is imminent, if there's any movement for this in California. At this time, there's none. This is just purely an informational update, but there were some questions about statistics related to master's level practice under the auspices of ASPPB, because they're the ones that have the data on their jurisdictions, and there's 66 various US territories as well as Canadian provinces. Currently, 22 jurisdictions have some form of master's level psychology practice, either independent or under supervision. California is one of them with Psychological Associates. But there are only 6 jurisdictions that currently have an independent master's level psychologist category. And these are Alberta, Newfoundland and Labrador, Nova Scotia, Saskatchewan, and the Northwest Territories in Canada, and Vermont is the only US state that seems to have that. That's all I have on this item. I can answer any questions you have at this time. Thank you.
Thank you, Mr. Berg. Any board comment, questions regarding this informational item? Dr. Kasuga?
I just wanted to share that when this was discussed during the Legislative and Regulatory Affairs Committee meeting, that Dr. Cervantes, who's not here today, brought up that, like, if there were in the future any legislation that that creates a master's level psychology practice in California, that the Board of Psychology should be that it should be housed in the Board of Psychology, or anything related to psychological services, that the Board of Psychology would probably be the most appropriate board to handle those licensees. But again, this is not in any horizon currently.
Thank you. Any other board comment on this item? Any public comment on this item? Please come forward, have a seat. On the microphone. Okay. Thank you.
It might be a bit longer. We could try. Just run past
Okay. Item number 17, the update and discussion on the development of the integrated examination for professional practice in psychology. Mr. Burke.
Thank you, Dr. Tate. And I apologize if you see me busily. I'm frantically trying to find where exactly in the combined packet this is.
Get that number.
Does that mean we should just go to lunch?
I was encouraged by council to keep moving forward.
Okay.
I'm still looking. I'm scrolling. I apologize.
Time for lunch.
Right, 400.
Of course.
460. Page 460 of the combined packet. We got there in the end, thank you. Okay, so I'm going to begin with just updates from what ASPPB have said. So they attended the February 2026 board meeting and gave a presentation on the new EPPP. Again, for the purposes we've been referring to it, the new exam, as the integrated EPPP. It's just going to be called the EPPP. Same old, it's just the EPPP 1 and 2 are going to be going away. I just wanted to clarify that, so in case there was confusion, because I know there was in February, for which I apologize. And all of the initial bullet points here were provided in February. So on March 12th, ASPPB provided an update to all jurisdictional members regarding upcoming changes to the cost of the examination. And they confirmed the fee structure will continue to include both Pearson's delivery fee, which at this time has not been determined because the exam's going to be slightly longer and that changes the amount Pearson will charge. It's currently $87.50, I believe. And the EPPP fee will increase from $600 to $650 beginning April the 1st, 2028. In addition, a biannual fee increase tied to the Consumer Price Index will take effect beginning April 1, 2030. So that's a smaller increase for the new exam than we potentially thought based on what was said during the first town hall earlier in the year, well, in 2025. Subsequent to what I put in the memo, I had a conversation with ASPPB, and there's additional updates. They plan to have the integrated exam live in Q4 of 2027. They're working with Pearson on that, and at this time they're probably not. They said they're not going to be offering new versions of the current EPPP 1 and 2 on March the 31st, 2028. In the spring of 2027, they will begin beta testing of the new integrated exam. And in March and April, they'll be asking for volunteers. There's going to be a town hall for BARC members. That's the body I sit on at ASPPB. It's board, administrator and regulator committee. It's essentially all the EOs of the boards, and that's going to be on June 9th, where they're going to tell us a little bit more. For those people that do volunteer, and ASPPB are hoping to get 600 to 800 people to take the exam. If you pass that exam during beta testing, you've passed the exam and you can be licensed. But the one caveat is you will not get an immediate pass-fail score during the beta testing period, because they will be using the beta testing period to basically determine what the pass-fail point actually is. Those are all the updates I have from ASPPB at this time. Continue to work with them and talk to them, and obviously I will be in attendance at the June 9 meeting, and any new updates that they give to us there, I will disseminate through all available channels, listservs, social media, etc. That's it as far as my ASPPB EPPP updates are. But in February there were questions again surrounding developing our own version of the exam, which the Office of Professional Examination Services has done that for us previously, and it was deemed at that time by the board that it was cost prohibitive and to not do that. And included in the materials is their cost estimate, which was provided previously, of developing a new exam and then maintaining it going forward. And then I come to my conversations with my counterpart in Texas. Texas, as you know, is beginning the process of developing their own exam. It's not going to be, the soonest it could probably be available is around 2030. So until that time, it doesn't exist, so there would be nothing for OPES to look into to determine validity, bridging study for any gaps between it and what's required to practice in California. But they had their May 7th committee meeting. The Texas Board of Psychology is a committee under a larger body, and they approved the essentially the request for bid. So they now have to wait till the June main board meeting, and then assuming it's approved then, they will then put out the scope of work request for bid, and then exam development people, psychometrician people can bid on that and they can really get the process started. Those are all the updates I have at this time regarding the developments surrounding the EPPP. Happy to take any questions from the board or the public.
Thank you for the update, and thank you for staying on top of this. This is a lot of information, and it's shifting, I feel like, every board meeting. So I appreciate the updates regarding Texas and the information you gave us today. Any other board comments, thoughts?
Just quickly, when you go to that meeting, Mr. Berg, I've heard a lot of feedback, both at our previous board meeting and in the current public comment submission, for some overlap period between the integrated exam as well as the existing exam. And I think it reflects the fact that there are some folks who are preparing for the current exam and unfortunately may be affected when the time comes for them to sit for that exam. Now, granted, I think some of us might have some thoughts on when you start studying for the exam. As a famous procrastinator, for me, this is a little bit early to start, but recognizing different learning styles for everyone, I think it would be helpful to ask about what an overlap period would look like. Perhaps even an extension of the launch of the overlap period being at least a year for those two periods. And that would be one request when you head into that meeting, rather than just a hard close date. And then again, encouraging the ASPVB to ensure that there's enough test prep materials to be made available for free, so that applicants have the opportunity to study for an exam, a new exam, and that they are supported through free test materials, test questions, et cetera, sample test questions, so that our prospective licensees are not going in cold on a new exam, recognizing that we don't have a long history of the new exam for folks to be able to prepare for.
Well done. Thank you, Mr. Fu. Dr. Kasuga?
I just wanted to clarify, Mr. Burke, the dates that you provided. You said that it's going to go live Q4 of 2027. Is that correct?
That is what ASPPB are planning. Yes, that's what we told.
And that's the plan. And then also the beta testing, is that going to be in March, April of 2027? Or is that like, I just want to make sure that I got that date.
Yes,
correct?
Spring of 2027.
Okay.
That's what I was told, so.
And that's the beta testing that they're asking 600 people to.
They'd like as many as
As many as
possible.
possible.
So, and when it comes time to sign up and apply for that, we'll do everything we can. We'll try and work with stakeholders. I'm sure CPA might want to help to send contacts to as many people as possible, just to let them know, hey, it's now an option. You don't have to take just the current EPPP 1. You could take this exam.
Yeah. Mm-hmm. And then, is there, the last time they were here in February, they talked about like jurisdictions before we're able to take the EPPP2, for instance. Would they provide that for licensed psychologist members in different jurisdictions to be able to take the test and during the beta period or a version
I
of
think
it?
during the beta testing period, you'd be able to you could volunteer to take the updated exam, or you could opt to take the current EPPP 1 or 2.
So like I can do it, not like a licensed.
That I don't know, but that's a good question if you wanted.
Yeah, because like before I thought it was like helpful to kind of like check out the test. I was able to do it for the EPPP2 before, and I wanted to see if that's still an option for this time. I think it's informational, and I am able to report back to the board the experience of the test.
Okay, no, thank
for
you.
whatever that's worth.
Any other board comment? Shelley, can we take public comment after, or do it now?
You can or you can do it now. I mean, the next one is going to be like 2 minutes.
let's take public comment.
Oh, we
Hi,
have,
Dr. Winkleman. Oh,
we have board staff
it's okay. Oh,
as well.
I'm sorry.
Hi, Elizabeth Winkleman again with CPA. I just had a quick question, and that is, and it may have already been resolved, but we had previously discussed whether the supervised professional experience was going to be required to be completed by ASPPB, whether they were going to require that before taking the integrated EPPP. And I was wondering if that has been resolved as it's relevant to the implementation of AB 282, which is designed to streamline the licensure process and allow applicants to take the exam after they have completed all their academic coursework for their doctoral degree, but would not necessarily, they could complete their supervised professional experience, but would not necessarily be required to do so.
What ASPPB has put out is that candidates should have completed all or most of their required supervised experience as determined by the licensing board or college. So they would be able to take it. AB 282 would still apply, but they are advising that you wait until most of your SP hours are done, if that makes sense, which could have, it's going to be interesting to see because one of the main drivers of AB 282 was to try and change the passage rate in the right direction, and ASPPB advising this, it could be problematic, but they will be able to take it with some SPE, not necessarily all.
I guess kind of as a follow-up comment, I think that it would be good to clarify is if it's required or suggested. There's quite a big difference between being, required or suggested. So, thank you.
Any other board comment?
I just think that if a lot of our prospective licensees would like to take the beta testing, that could really help, with having the Californians taking the exam be part of the pass-fail study.
I'm sorry, any other public comment? I'm
Oh, sorry.
I jumped from Dr. Winkleman to you. Any other public comment on this item? This is an informational only item with a lot of information. Perfect. Any other board comment before we break for lunch? Perfect. We'll take 45 minutes, so we'll be back at 12:50. Perfect. Thank you so much.
Oh, I thought we're done.
Yeah,
I was like, aren't we done?
It's only
Items for,
I know, but the commendation,
That won't take long.
oh, no, we already did the 15 minutes.
no.
Go.
The Dr. Cervantes commendation.
Yeah, we're just going to do that at the end like we did for Dr. Phillips.
Oh, she's not in here, we're still doing it. That's fine. It's up to you.
No, it's
I think she might appreciate it having read into the report. It'll be quick. It'll take that too.
No, I just.
what we're going to do.
Sorry. I thought we weren't. I apologize.
No, we'll do the recommendations for agenda items for future board meetings for the board. Does anyone have a suggestion?
I do have a mindfulness suggestion for our next board meeting.
Perfect. So I think do you have that, Ms. Whitney? And also, I'm interested in that CDCR presentation. I don't think it's going to make it for 2026, but 2027, I'd like to hear about what's going on in that direction.
I think that's good, yeah.
And also not for the agenda, but Mr. Fu, an article from you, just throwing that out there.
Heard and received.
Any other board member for a suggestion? Any public for a suggestion for one of our fun and exciting board meetings? Any topics for us that you would like us to put on the agenda, consider putting on the agenda?
Sorry.
Yes.
I have one with regards the stakeholder meeting for the Board of Behavioral, the LEP issue with regards to BBS, I think it's like coming up, right? Like that we're going to have the, any updates on that, like stakeholder meeting or?
Yes, the stakeholder meeting, it was determined by the licensing committee that we sent out a survey, and the survey have gotten a bunch of results back, and yes, that will be included.
In the agenda?
Yes.
Okay, thank you.
Perfect. Any other board suggestions? Any other public suggestions? I do not see any. Before we adjourn, Mr. Polk, can you please tell us how to document our CPD credit?
Thank you for attending the board meeting today. For attending the full duration of today's meeting, since this meeting went past the 3-hour mark, 6 hours under CPD category number 1, attendance at a California Board of Psychology meeting will be credited. For your CPD records, please notate today's date as May 15th, 2026, the name of today's meeting, which is board meeting, and 6 hours for your records. Again, please maintain this record, as certificates of attendance will not be provided after the meeting. Again, since today's meeting was designated as in-person meeting, CPD credit will not be given for viewing the meeting through the webcast, as the webcast was for streaming purposes only, and there was no option to interact during the public comment periods. Thank you again for attending the board meeting, and please sign out on the attendance sheet before leaving today. Thank you.
Thank you so much, and thank you to everyone for coming. Hope to see you in sunny San Diego.
Thank you. Gavel.
Thank you.
Thank you.